and welcome to our NewsX podcast show, which is Get Candid with Chitvan. Today, we have joined with Akansha Rajiv, Director and Client Executive at Tree Technology. With over 18 years of experience in healthcare, IT, Akansha has made significant contribution to healthcare system in India and innovative work she is doing at Tree. Hi, Akansha, how are you?
Hi, Chitvan. Thank you for having me.
So, Akansha, my very first question to you, Akansha, can you share your journey in the healthcare IT industry and what led you to Tree Technologies?
Sure. So like you said, I have about 18 years of experience. From the very start of my career, I have been with healthcare IT giants like Cerner, Siemens, Dell, United Health Group. This experience that I got in the various products and services catering to the various global market, including the US, this really enhanced my knowledge and skill in the field of healthcare IT. And once we got into a project, along with my other co-founders who are also part of Tree, we realized that there was a lacuna of the same in the Indian healthcare space as well. So that is when we decided to bring our skills that we had earned working for other countries to have a Make in India initiative. And we formed Tree Technologies with a very clear focus on not just the patient administrative systems, but also the clinical systems that are required for hospitals in India.
So what does your role and as a director and the client executive at Tree Technology entail?
So basically, I'm also the co-founder of the company. So I'm accountable for all the deliveries that we make in Tree. So I have led various functions because as an entrepreneur, whatever it takes to get the business going, so whether it is sales, whether it is delivery, whether it is implementation of our products. So all of these things I take care of.
So how is Tree Technology driving innovation in healthcare delivery?
So from the very start, like I said, there were already a lot of competitors in the market when we had started this journey, but they were very focused on what the market needs were. When we got into this particular space, having worked in the different global markets, we knew what was to come. So we came here with a vision of making innovative products, bringing innovative products into the market, along with the normal HIS, hospital information system, that is our core business. So as of today, what we provide to our clients is a complete digital platform, which not just includes all the administrative functions, it also includes the complete electronic medical record of the patient. We are trying to get the doctors to use the system, digitized prescriptions. We have also incorporated AI, built-in AI into our product, and we are now offering them as part of our solution to our clients as well. One of the other things that we're also trying to do is that, as you know, in India there is, this is a very big market for startup, and healthcare IT, right now is a very exciting time to be in. There are a lot of niche players in the market. So as a platform, we are also holding space for them to come and integrate with us so that our end clients, which are the hospitals, derive value from all of us combined together.
So nice. So can you elaborate on the work with the Ministry of Health and Family Welfare on the MDDS initiative?
Absolutely. So this was about maybe 7 to 8 years back, when I was in United Health Group. United Health Group is one of the largest insurance providers of the US. They were also foraying into the Indian market. And when we did that, we engaged with the ministry to first set certain healthcare standards for India. Okay. India, even as of today, lacks a lot of standards, although the Indian government is being very proactive now for the last 2-3 years, especially with the formation of NHA before and then the rollout of ABDM. But back then, this was the MDDS standards were the metadata standards for healthcare IT, which are part of most of the RFPs that are rolled out for e-health in India.
What are your thoughts on the future of healthcare IT and the role of triage technology with play in it?
So pre-COVID, the use of healthcare technology was a trend, but not a need. There was a very steady but slow growth. But COVID made the healthcare organizations realize that the shortage of caregivers and an exponential increase of patients will require automated processes and contactless care being provided to the patients. Triotree was already set with that kind of a vision from the very start, and sort of post-COVID, we got validated with all of our clients. We already had within our portfolio the services like completely paperless OPD management and prescription. We had telemedicine and virtual consultations built into our product. So all of these things played a very vital role post-COVID for many of our clients. Going forward as well, as you know that AI is playing a very big role in fact, almost all of the industries, healthcare technology being one of the most prominent ones. So we are also making use of that to ensure that the physicians are able to are being helped by AI in personalization of the usage of the application to provide better care to their patients. AI is also helping them create personalized treatment plans for the patients, and a lot of other areas in which the operations can be bettered with the use of AI. Remote patient monitoring is also something that I feel is going to exponentially grow in the coming years. We are poised for the same growth because through partnerships or through inbuilt applications that we are now building as part of our portfolio.
What advice would you give to professionals aspiring and enter the healthcare IT field?
Just IT field or anyone helping the health IT field?
Health IT.
Health IT. So I think these are very, very exciting times for the healthcare IT industry. And that is validated by even the fact that there are so many healthcare MBAs that are springing up, with healthcare IT focus being one of them. Today's CEOs and COOs rely very heavily on these digital systems to provide them with the data and the key indicators that will tell them about the health of how their operations are going, how their business is doing. So anyone who is trying to enter the healthcare IT, there is so much to do right now. Back when, 18 years back, when we had forayed into this field, it was a very, very nascent field, and pretty much everything within our hospitals was manual. But now we are talking about, contactless care. We're just walking into hospitals and expecting the kind of experience that you would get when you go to, cinemas and movies, that kind of patient experience we're talking about. So there's a lot more to be done in this field, and we need people with innovation mindset. We have the tools like AI and machine learning, all of these IoTs, everything is available for us. We just have to put our minds together, innovative minds together, and create something which is good for all of us in the value chain, including the patients, because all of us are patients. The patients, the hospitals, the government, and the insurance companies.
So my very last question to you: what exciting project or initiative can we expect from Triage Technology in the near future?
So there are a lot of exciting things as part of our portfolio that we are working on, and we are rolling them out in various releases, various quarterly releases. The first set of them that has just gone out in the last release are AI-driven dashboards, which will help the healthcare organizations in their discharge planning, etc. The next set of our releases will include certain innovative ways of practicing medicine for the physicians. And we have a few other things that are there in the pipeline, which we'll roll out in the due course of the year.
So nice. Thank you for sharing your insight with us today, Akansha. It's been a pleasure learning about your impact, work in healthcare IT, and the innovative strides you're making at Triage Technology. Thank you for Get Candid with Chitvan.
Thank you, Chitvan. Thank you for having me.